Welcome to Dr. David Eifrig's Health and Wealth Bulletin, a publication of Stansberry Research. This is Weekly Update. Around here, we like to keep up with national and worldwide days dedicated to health and wellness. That's why this week we're focusing on liver health. July 28th is World Hepatitis Day. Now, hepatitis is a disease where your liver gets inflamed. It's responsible for about 1.34 million deaths each year, and about 300 million folks live with it without even knowing they have it. So today we're going to give you our 5 and 5 tips for a healthy liver in just 5 minutes. So let's get started. Tip number 1, get tested for hepatitis. There are 3 types of hepatitis, but we're going to focus on hepatitis C. It's spread through sex, sharing needles, and direct contact with infected bodily fluids like blood. It can last your entire life. Now, Hep C affects about 3.5 million Americans, but 80% of those folks were born between 1945 and 1965. Doctors believe it's because of hospital errors and the practice of reusing needles until the early 1960s. Worse, this type of hepatitis rarely has symptoms, but can lead to chronic liver disease and potentially liver failure and death. So if you're between the ages of 53 and 73, ask your doctor about a simple test to see if you have this treatable disease. Tip number 2 is to lose weight. Now, I know this one sounds pretty standard for our health in general, and it is, but extra weight puts us at a higher risk of something called non-alcoholic fatty liver disease. Now, this liver disease is expected to become the biggest cause of liver failure in the coming years. Worse, sometimes it also leads to scarring and liver cancer. Now, only about 10% to 15% of people of normal weight get this non-alcoholic fatty liver disease, but 70% of obese folks will get it. So to curb this disease, maintain a healthy weight, get plenty of exercise, and cut back on processed foods. Not only will getting rid of these foods help you with weight, but will also cut inflammation, which also damages organs like your liver. Tip number 3, don't waste time on a liver detox. Your liver is already well equipped to detox your body. It filters out harmful chemicals like alcohol and keeps our bodies healthy on its own. But buying into these so-called cleanses will just waste your money. Antioxidants, like those found in turmeric, help detox our bodies naturally. That's why we recommend adding this spice to your diet. It's also a good reason to enjoy plenty of antioxidant-rich foods like fruits and vegetables. Even better, the most commonly consumed antioxidants come from coffee. And the World Cancer Organization added coffee to its list of ways to prevent liver cancer. Tip number 4 is to take medications carefully. Your liver also detoxes our bodies from medications that we take. But our livers can only take so much. For instance, according to the FDA, nearly 50% of liver failure cases in the US are related to acetaminophen, the popular pain reliever. And far too many people ignore the dosing instructions on over-the-counter medications like acetaminophen. That leads to overdosing and causing potential damage to your liver. So always follow the dosing guidelines. And don't take any over-the-counter medicine for more than 2 weeks unless your doctor advises you to do so. And finally, don't take any medication with alcohol. Which brings us to tip number 5, cut back on your boozing. Too much alcohol is still one of the top causes for liver disease. That's because too much booze damages our liver cells. It leads to buildup of fat, alcoholic fatty liver disease, or scarring called cirrhosis. Now, cirrhosis can lead to serious issues like liver failure and even liver cancer, which is one of the deadliest cancers out there. You can also get alcohol-related hepatitis. And it's not just a lifetime of abuse. According to a recent report from the BMJ, the group with rising rates of folks dying from cirrhosis is actually adults ages 24 to 35. In fact, all age groups saw more deaths from liver disease during the study period of 1999 to 2016. But these young adults had the largest increase in cirrhosis death rate at 10.5%. Now, we always say to drink in moderation. That typically means no more than 1 drink for women or 2 drinks for men per day, though limiting yourself to just a few a week is a good choice. These 5 tips will help keep a healthy, happy liver in your body. And again, if you're a baby boomer and haven't been tested for Hep C, we urge you to get tested today. That's it for now. Don't forget to like, share, and subscribe, and we'll see you next week.